Disclaimer: this video is for educational purposes only, and the individuals included are not professionals.
For the background of the study to our chosen topic entitled Chronic Stimulant Use, an upcoming cause of neurocognitive disorder in later life. First, let us define what is stimulant first. Stimulant are a class of drugs that speed up the messages travel between our brain and into our body. This stimulant make a person feel more awake, alert, confident, or even energetic. And this study helped us to explain the possibility factors and effect of chronic stimulant use. Those consistency of taking non-medical use of drugs that are legally available have been explained. Yung factors such as the function of the brain by transmitting information, the developing of cognitive disorders, having a cognitive deficits, and having those psychotic episodes, also the neurocognitive disorder that develop, and other effects that because of those drugs. This study also shared the possibility about how different kind of drugs may affect our body, lifestyle, health, and even our behavior. Stimulants like this cocaine, nicotine, amphetamine, and nicotine, that how much do we know about these substances that we are taking into our body? This drug that we use during youth has a significant effect in the future state of the brain and our body, even behavior. This is because of those substances. Also, this case study present the experience of a 58-year-old prostitute that has a chronic daily stimulant use for more than 30 years. Especially, she used cocaine, nicotine, amphetamine, those drugs that make this have changing in her behavior, personality, like memory problems, living more isolated, and having hallucination. She even being aggressive. She having psychotic episode like delusion, hallucination, behavior problems, even develop cognitive disorder. This study observes, use diagnostic tests, and it describe a case of NCD or neurocognitive disorder that most likely caused by chronic use.
The purpose of this study is to explain some factors and effects about chronic stimulant use, such as developing cognitive disorders, having psychotic episodes, damage of the brain, and also the malfunction of transmitting information between body and brains. And it can also cause suppression of brain maturity. People who use stimulants regularly would be prone to hallucinations. They may become dull and slow in the thinking and reasoning process. They may find understanding of things that they experience difficult and confusing. Sometimes, they may find it hard to explain experiences and certain situations that materialize. The learning process would slow down or become weak or sometimes unattainable. This study aimed to be an alert with the negative effect of chronic use of stimulants, wherein it enables us to use stimulant drugs in a proper way or with a doctor's supervision. It also proposed to prevent humans from taking stimulants chronically in a way of self-prescription. It also serves as an eye-opener to inhibit major neurocognitive disorders cases from increasing. In addition, the study is warning that self-medication or let's say self-prescription often leads to more critical conditions. And also, using stimulants at a very young age to medicate common comorbidities should be prevented because the negative effect of these substances will take effect in declining years.
The researcher of this study used a single case study design. The single case design, which is also frequently referred to as the single subject design, is an evaluation method that can be used to rigorously test the success of an intervention or treatment on a particular case. This method provides evidence about the general effectiveness of an intervention while using a relatively small sample size. As shown by this case, a significant neurocognitive dysfunction may have been brought on us as a consequence of the patient's long-term, everyday usage of stimulants. The researcher takes into consideration a potential etiological factor of neurocognitive problems since the use of illegal stimulants for extended periods of time is becoming more common among people of advanced age. It used a single case study design as the tests were carried out in order to examine the underlying etiology of the cognitive impairment that have previously been identified to systematically compare participants' targets behavior before receiving an intervention to the same behavior during and after the intervention was introduced. Furthermore, the researcher also utilized a quantitative research design which allowed researchers to conduct simple to extremely sophisticated statistical analysis that aggregate the data. The quantitative research design refers to the set of strategies, techniques, and assumptions used to study psychological, social, and economic process through the exploration of numeric patterns and gathering a range of numeric data. In this case, Wechsler Adult Intelligence Scale was undertaken to measure intelligence to interpret scores. The researcher made use of the systematic assessment by Kaufman and Lichtenberger. Total intelligence level and the intelligence on the three sub-levels were assessed. Hence, to the test, the patient's ability and speed to process information, a digital symbol substitution test, and a symbol search test was carried out. Subsequently, in order to get the data from the patient tests and examinations were administered to the patient. Additional testing in the form of exhaustive neuropsychological evaluation was carried out as the part of this assessment. The Western Adult Intellect Scale, often known as the WAIS, was used to perform the task of measuring intelligence. In order to make sense of results, the researcher resorted to the methodical analysis that Kaufman and Lichtenberger had developed. The overall intellect level as well as the intelligence of each of the three sub-levels were evaluated as having a 4 score.
Presenting now for the result of the study. The results that are shown based upon the information that was being gathered from the beginning of the case study. It is about a 58-year-old woman who was diagnosed with a major neurocognitive disorder with behavioral problems with the history of chronic daily stimulant utilization. The old woman was admitted to a psychiatric ward because of a psychotic episodes wherein she is said to be losing in touch with the real world due to situations that she perceived instances in a not relatable way or without in the sense of reality, and that is what we call psychotic episodes. This psychiatric history of the patient revealed that chronic daily stimulant use for more than 30 years. She has specifically taken nicotine, amphetamine, and cocaine. For the reason said that the patient worked as a prostitute and she had to take stimulant substances for her to be able to do her work and at the same time is to take care of her child. Then, after years of using stimulant, her daughter had seen or noticed behavioral changes and progressive memory problems with the patient, as it shows negligence of itself, and the patient even did barricade their house as she started to live more isolated due to the effects of stimulant in her mind. There is also a situation that she had shown aggression toward their neighbors because she does not have trust to anybody, that she is seemed to be hallucinating. Also, different tests and examination is conducted by the researchers to be able to identify if stimulants had really contributed to the major neurocognitive disorder possessed by the patient. Based upon the physical and neurological examination that was done to the patient, the result did not reveal any abnormalities to the patient's physical and neurological state. However, paranoid delusions and auditory hallucination were indicated on the patient psychiatric examination. That works like the patient is having irritational thoughts and fears to those things that she's not feared before. And auditory hallucinations works as if the patient is hearing voices or noises that is not being heard by the people around her, because the voices or noises is literally coming from the mind. The researchers treated the psychotic symptoms of the patient with the use of risperidone. It is a drug that is usually given to those patients with mental health condition like schizophrenia, wherein it enabled the patient to see, hear, or feel things that are not there in reality. The treatment was a successful one. The symptoms are then subsided, and later on, the treatment was completely stopped as when the psychotic symptoms did not relapse anymore. The patient also had possessed severe memory impairment and problems with planning and organization. Although patient is cooperative through the psychiatric assessment, the assessor struggled on making an eye contact or a real eye contact with her, because the attention of the patient is also been a struggle for the assessors, as it was hard to attain the patient's focus onto a particular subject. They have also noticed that the patient is having an age regression. It looks like she is reverting to a younger state of her mind because she was wearing clothes more typically worn by younger women. Also, repetitive behavior and perseveration in speech were observed, such as continuously asking same questions. Then the patient also undergoes into neuropsychological examination, wherein her intelligence is measured, that the result shown that there is a deficit in memory, attention, and information processing speed, executive functions, and visuospatial ability. The MRI or the magnetic resonance imaging were also used to investigate the underlying etiology of the established cognitive impairment, and later on, the MRI showed confluent subcortical and paraventricular white matter lesions and dilated ventricles. The question remained as, what could have really caused the psychotic episode if there were tests and examinations that shown no abnormalities? Then later on, the answer was provided, which is the vulnerability of psychosis given the history of psychotic episode. The researchers considered the psychotic symptoms as a neuropsychiatric symptoms that emanates from a neurocognitive disorder, since cognitive impairment were already observed before psychosis emerged. The chronic stimulant use of the patient had resulted microvascular diseases that affects the cerebral blood flow, causing her to have stroke and toxic leukoencephalopathy that are possible cause of the white matter lesion that is seen in the MRI result. The researchers therefore indicated that major neurocognitive disorder with behavioral problems most likely had a vascular etiology as a consequence of chronic daily utilization of stimulants.
And for our conclusion, these aging cognitive disorders and substance use are need to be given more attention than we think. The possibility that has been explained in this case study, that chronic daily stimulant use resulting in a major neurocognitive disorder must be thought more frequently to prevent some big issues when it comes to health, behavior, and everything that have been tackled in this case study. The learnings and knowing the some possibility factors will be such a help for everyone to manage a situation that are connected in this case study.
This case highlights the possibility of chronic daily stimulant use resulting in a major neurocognitive disorder.
Since the prevalence of long-lasting illicit stimulant use among older adults is rising, we suggest considering this as possible etiological factor of neurocognitive disorders.